fat embolism is the commonest cause of death following BBL is not correct information. I'm saying this because I've never seen it in my practice, I've never seen it in my training, and none of my colleagues has ever reported any case of fat embolism. So it's very, very rare. I don't know where he got the data from. Maybe it's common among whites, but in the black population, I've not seen that, and it's very, very rare. Fat BBL is very safe. It's safer than doing appendix surgery. It's safer than doing CS. It's safer than most procedures that people do. So that information is not correct.
Wait, did a doctor just say that BBL is compared in terms of risk and safety to C-section? Well, medicine is not based on, I haven't seen it in my practice. It's based on data, research, evidence. Otherwise, anybody, even doctors that are coming out of school today that have seen 2 patients, can come and say that something is safe because they haven't seen it in their patients. And you can also say, I haven't seen anybody die of smoking. Does that mean smoking is safe? Studies that have been published in plastic surgery journals clearly state that BBL have one of the highest mortality rate in plastic surgery. The reason is simple. When fat is injected around the muzzle, there are large blood vessels there. Any speck of fat can easily travel through those blood vessels to the lungs, to the wherever, and cause sudden death. It's not rocket science. It's easy to understand. So comparing C-section to BBL does not make a lot of sense because BBL is an elective surgery. That means you don't have to do it. C-section is done to save a life, to save the mother and the child. You don't have an option. Otherwise, there could be mortality. So my people, you are responsible for your health. BBL poses risk to life. It's as simple as that. It doesn't mean that anybody that gets it will die. It doesn't. But the risk is there. That is how come before you go under any type of surgery, you will sign a release for the doctor. I don't know how it's done in Nigeria. That's how come you see these doctors walking around, even when people are buying up and down. They have already signed. I'm assuming because that's how it's done here. Before you touch a patient, they have to sign, giving you the consent to touch them and also waiving you from any risk that can come from it. However, there is something that is called gross negligence. If you simply was not paying attention or do something that is just out of ordinary, they can still persecute you. But I don't know how it works in my dear beautiful country. So I don't know if these things are investigated or not. But anyway, the best practice is for you to be responsible for your health. That is why I make these videos that I make, teaching people about things. Because when you have knowledge, you will be able to ask the right questions. So if somebody is not doing what you expect, you don't go to doctors blindly. You should have some knowledge. Because there are good doctors, there are bad doctors. The same way there are good police, there are bad police. For example, let's say a doctor is about to perform surgery on you. They didn't bother to check your blood pressure, or they didn't bother to check your weight, or they didn't bother to check your health. You should be able to know that something is off already. And that would be your cue to go to a different doctor. I just didn't like when people that know better come and say these things. It does not mean that people should stop performing plastic surgery or BBL. People are going to do it no matter what you do. But let them understand the risk. And if they still decide to do it, that's okay. But I don't want you making people believe there's no risk. Oh, it's just as taking this. It's just the same thing as doing this and all that. Downplaying it. That is what I don't like. Thank you for watching. Until next time, may God bless you. Bye-bye.